Hi everyone, my name is Rati and I'm a biokineticist. Today I'll be speaking with you a bit about knees and common knee injuries. The knee is one of the largest joints in the body and it's also one of the most complex. It is, however, so intricately designed with a lot of mechanisms in place to protect it from common injuries. So you have your knee that is made up of the femur and the shin bone. And the ligaments are kind of pieces of tissue that just connect those two bones together. Ligaments also protect the knee from any unnatural and excessive movements, either anteriorly, which is in front, posteriorly, which is behind, medially, which is towards your other knee, and laterally, which is towards the outside. So those ligaments do protect the knee against those movements. Meniscus. If there is excessive or unnatural movement in any of those places, that can result in a tear of the ligament. The knee is also composed of menisci. Menisci are little C-shaped pieces of cartilage that are between the two bones. So they help the joint to articulate well, which means that the bones can move well in relation to one another. And they act as shock absorbers. So when you're jumping and you land really hard, in order to prevent those knees from rubbing together or hitting together and cracking, your cartilages protect your knees against such activities, such movements, such injuries. The cartilages or the menisci are most commonly injured by rotary movements, or any unnatural excessive rotation of the knee can cause a tear in either menisci, your medial menisci or your lateral menisci. Menisci can also be injured as a result of one being overweight. So that would be more of a wear and tear injury, and that's something that is chronic and happens over time. However, you do also get acute injuries, which could happen, as I said, as the result of a rotation. So if your foot is planted, but your knee rotates either medially or laterally, which is either clockwise or anti-clockwise, if you can think of it that way, then it will result in a tear in the menisci or in one of the menisci. So in terms of treatment plans, the treatment plan does depend largely on the severity of the injury and the age of the individual who's been injured. If the case is not too severe, then a treatment can be done by means of an exercise program. And then if it is severe, surgery is definitely a necessity. And after your healing period, then you would progress onto an exercise program. The exercise programs are definitely scientific, and they relate very closely to the mechanism of injury, to the healing of the injury or whichever ligaments or menisci are injured, and to load that is placed on the knee. In terms of your ligaments, the same would apply. And then, in terms of symptoms include pain, swelling, knee discomfort, knee instability. We also have a lot of patients reporting of hearing a pop sound, more likely in the cases of a ligament tear. In your severe cases, you can also have either ligaments, so plural ligaments, torn instead of one ligament, or you can have ligaments and menisci torn in the same injury. So those are also the most likely cases that would need a surgery. So if you have experienced any of these symptoms, or if you are currently experiencing them, I strongly suggest that you do get your knee assessed by a professional and then seek help accordingly. Thank you.